Hello, my name is Jessie Jensen. For this class, I did my research paper on trauma-focused CBT and how it helps kids between 6 years old and 12 years old who have been through trauma like abuse or neglect, um, and how it can help them better manage their emotions. So I did a PowerPoint, and I am just going to share my screen here. Um, so we can check it out. Mhm. There we go. Okay. So here is the PowerPoint that I made. Okay. So, again, this is about exploring the impact of trauma-focused CBT um, on emotional regulation in children ages 6 to 12. So discussion points today will be my research questions, my hypothesis, theoretical framework, methodology, um, sampling frame and recruitment, procedures, measuring tools, anticipated limitations, anticipated outcomes, and then I'll show my references at the end. So pretty much just this PowerPoint is like breaking down all like the key parts of my paper. So my research questions were, how does trauma-focused CBT affect emotional regulation in children ages 6 to 12 who have experienced trauma? How does caregiver involvement in the trauma um, trauma-focused CBT influence emotional outcome? And how does the trauma-focused CBT compare to other therapies, like standard CBT or play therapy, in promoting and the growth of emotional regulation throughout the course of the therapy? So the hypothesis of my paper was that children aged 6 to 12 receiving trauma-focused CBT will demonstrate significantly improved emotional regulation skills versus others that were receiving different therapeutic interventions, and that caregiver or parental involvement will significantly enhance like the outcomes of their development in emotional regulation throughout the um, session of the therapy. Um, for a theoretical framework, trauma informed care pretty much focuses on like that safety, the trust, the choices of the client, and empowerment. CBT, obviously, this says that like emotional regulation can be improved by modifying negative thought patterns, which in the paper, like we make sure that we clarify the difference between just CBT and then trauma-focused CBT. Um, Attachment theory is discussed also in the paper. Secure caregiver parental child bond will support the emotional development of a child. And then developmental psychology emphasizes age-appropriate developmental, um, you know, tailored interventions that work for each age of the child in the study. Methodology looks like the design was quantitative um, and quasi-experimental. Um, the approach was pretty much to compare the trauma-focused cognitive behavioral therapy to standard CBT or play therapy or other therapeutic interventions. The duration of the study was 12 to 16 weeks. The data collection points were pre, mid, and post-intervention. Um, so that's that. The sampling frame and recruitment population again was the children 6 to 12 years of age with a history of trauma. The sampling method is the stratified random sampling based on the trauma type, gender, things like that. The recruitment site was pretty much like outpatient clinics, like mental health centers, pretty much just stuff like that. Um, Inclusion criteria, children in the trauma-focused CBT programs, obviously. And then obviously children who could not participate in the study would be children that were like outside of that age range of the 6 to 12. Um, the procedures, were pretty much to obtain informed consent from caregivers or parental figures, um, from like for the children to contribute to the study, and like the child obviously, had a say as well. Um, the upon like intake, the administrator baseline measures, which pretty much is like where is their baseline before the intervention. Um, and then we would deliver the 12 to 16 week trauma focused CBT, individual sessions and joint sessions with the parent or caregiver. And then the post-intervention assessment happened. So after the 12 and 16 week mark, 12 to 16 week mark was up, they did a post-intervention assessment to see, where the kids are now after the intervention has kind of been completed. And then data analysis after that. So measurement tools that were included were an emotional regulation checklist, the child behavior checklist, and then the childhood trauma questionnaire that they used. Anticipated limitations looked like a non-random assignment, so potential like selection bias, despite the stratification. I can never say that word. Um, And then self-report bias too. So like a caregiver and child's response may be influenced by like perception, which makes sense. And then results may not apply to inpatient population, um, or rural areas. Um, Varying caregiver involvement. So like if only some kids' parents, you know, are involved in a good way and then others aren't, that could be like a limitation to the accuracy of the outcome of the study. Um, and then like any ethical concerns, like a risk of emotional distress or like re-traumatization or anything like that during like the assessments or during actual intervention. Um, so that's that. And then the anticipated outcomes. And the relevance to social work. So the trauma-focused CBT is expected to improve emotional regulation more than the alternative therapies that are used within, like throughout the study that they did. Caregiver involvement will likely enhance the outcome of um the child and their emotional regulation skills. Um, the study supports evidence-based trauma-informed practices that they did, and it offers data to inform clinical and policy decisions in children in a child's mental health, which is important. And then these are some of the references from my PowerPoint, but also like obviously I had all of the references listed in my paper. So yeah, that's my PowerPoint. I hope you enjoyed. Thanks so much for listening.